It is genuinely an honor to be with you. What a tremendous crowd. And I'm enormously proud to be representing Arizona State University and President Michael Crow, who is a passionate supporter of St. Vincent de Paul. As it happens, I'm also wearing another hat as a proud partner of St. Vincent de Paul in the mode of president of the Human Services Campus. And Steve mentioned the work that we do together, and it's a privilege to be here. Now, through that work, I've recognized that these complex challenges that we face in the community teach us some lessons and teach us humility. And one of the lessons I've learned is that goodwill and passion, while necessary, is not sufficient. There are no easy solutions. The issues are too big, too complex for any one entity to tackle themselves. Whether it's government, an academic institution, a community-based organization, no one of them can get the job done by themselves. Collaboration and partnership are essential to create the opportunity for social transformation. This is true, maybe especially true, for really big institutions. And you've heard that this is the biggest St. Vincent de Paul in the world. You may have heard that Arizona State University is the biggest university in the country. We say that once in a while. And so you think, well, what's the potential if these two large, socially motivated organizations work together? And ASU and St. Vincent de Paul have had collaborations for many years, but 2 years ago they said, what if we really doubled down on that collaboration and see if we combine forces, what additional impact could we have? Now, this is not something that every university would do. Most universities are basically inwardly focused. How do we make ourselves better? Not in a bad way. How do we give a better education to our students? ASU has a different charter, as you know. President Crow has articulated this so well, that we seek to be inclusive, to offer greater access, to do research that makes a difference in the world, and perhaps most importantly, to take responsibility for the communities of which we are a part. That means turning all the assets of the university, thousands of researchers, tens of thousands of students, staff, and faculty who are dedicated, and turning them towards the challenges of the most vulnerable members of our community. Now, in order to do that, and to do that effectively, you can't glibly walk out into the community and think you know all the answers. You have to rely upon partners like St. Vincent de Paul, that are strong, socially embedded, have spent years understanding the needs of the community, and pair with them so that all of the assets and resources and strengths that you have are applied in the most effective, meaningful way. And that's what has been taking place through the partnership between ASU and St. Vincent de Paul. We are enormously excited about what has been accomplished already, and you're going to get a taste of that in the video that's about to play. And we are extremely enthusiastic about what this partnership will bring in the years ahead. Thank you for your time. Here's a video that tells you something more about what's going on under the ASU St. Vincent de Paul partnership, and I wish you an enjoyable rest of the breakfast. Thank you.
We look for partners to be scalable, that is, they're able to take on the scale of a problem. In St. Vincent de Paul, we see all of those things as a part of the way that that institution has evolved, and its match with our value system, our idea about scale, our idea about community engagement, community service.
St. Vincent de Paul works to feed, clothe, house, and heal people in need in our community. We foster community resilience by bringing together those who can give and those who have a need in the most personal, face-to-face way as possible. The partnership with ASU allows us to take the strengths of the university in research, expertise, and innovation, and integrate them into our work in ways that directly impact our programs and the people we serve.
We travel the world looking for sustainability solutions and hotspots, and we just realized what an impact people getting on board in a local way can have. There really aren't any solutions without individuals each choosing to make an impact. And so every person involved in this process has been part of the garden and part of the urban farm.
The partnership requires the contributions of what we call time, talent, and treasure, all three. People's time, their talent, their energy, their ideas.
We see this more as a larger family towards the shared mission and shared vision that involves some of the opportunities that address not only the research needs, the community needs, but us as individuals, our relationship. And really those are the types of partnerships I look for now, is how can we work with good people doing great things to make an impact.
We are helping to build the next generation of leaders and community champions, students who will come to understand the complexities of the challenges we face in our community and will be inspired by the volunteers and staff who have dedicated their lives to caring for people in need. By working together, we're able to learn and grow in ways that we couldn't do alone. The St. Vincent de Paul ASU Partnership can help to power transformational social change by engaging all of us as co-collaborators in building the community that we all want to be part of. That's the hallmark of a powerful partnership. We look forward to working with ASU to make that community a reality for all of us. We are the society of we're all in this together.
Good morning. My name is Gabe Scheibe, professor in the Edstead College of Nursing and Health Innovation at ASU. For more than a decade, it has been my privilege to collaborate with St. Vincent de Paul's Ivy Center for Family Wellness. We've developed health promotion and diabetes prevention programs, and these programs are making a direct and measurable impact in our community. Through our work together, we've learned that lifestyle intervention can reduce diabetes risk and improve quality of life in the most vulnerable and underserved populations. This work is focused on children and families. We have a goal of transforming generational health. But what makes this work unique is that the interventions are not engineered in the ivory tower of a university, but rather they're designed and delivered by dedicated community champions to meet a pressing community need. This collaboration has led to 15 research papers in very well-respected academic journals, as well as major funding from the National Institutes of Health. However, when I get the chance to talk to peers and colleagues about this unique partnership, it's the opportunity to do meaningful work with great people that is most rewarding. This partnership is making an impact well beyond ASU and the Valley. However, the greatest indicator of our success are the lives that are being transformed. This work has allowed our research at ASU to impact real people. We can publish lots of research papers, but we can't create social change, make a real difference without a highly skilled and dedicated community partner. St. Vincent de Paul is that partner. Working with Elva and her team has made me a much better scientist and, more importantly, a more compassionate person. It is an honor to share this stage with her.
Good morning, everyone. My name is Elva Hooker, and I've been a part of St. Vincent de Paul Ivy Center for Family Wellness for the past 11 years. It's crazy. Starting as a community health educator and now as director of a tremendous team of staff and volunteers. Our partnership with Gabe and ASU has taught us to be more strategic and incorporate scientific inquiry and research into the work that we do. And it has also broadened our vision for the impact that we can make on health beyond our center's walls. We have worked passionately to empower individuals and families in diabetes prevention and management. We teach classes in nutrition, physical activity, and much more, life skills. And as you saw in the video, some of those clips, you could see some of the classes that we have. They're interactive and they're fun, and we work to engage participants in taking responsibility for their own health by providing them with the skills that they need to be healthy for a lifetime. One parent recently took her daughter to her medical follow-up visit and was told that she no longer had prediabetes. And even more importantly, Mom noticed that her daughter was more open and talkative and really had a new level of self-confidence because of our program, because of the work that we do. And we are so proud to just be a part of this family's story, their journey. This is just one example of why our program is successful. We embrace our families holistically and walk with them as members of their family. While our primary role is to help them understand what their health needs are, we also strive to support them in realizing their dreams. One patient we helped is Daniel Munoz. His family had come to St. Vincent de Paul originally as medical patients, and we discovered that Daniel was at risk for diabetes. We knew then that they needed the support to make the lifestyle changes they would need to improve their quality of life. I'm honored to introduce to you Daniel Munoz.
My name is Daniel Munoz. 3 years ago, my dad, who had many health issues, suffered a stroke. That really scared me. I realized then that I needed to make some changes in my own life. Fortunately, my mom encouraged me to participate in the Every Little Step Counts program with Elva and her team at St. Vincent de Paul. I learned the importance of good nutrition and exercise. After completing the program, I had lost 40 pounds, gained so much more confidence, and began the journey to where I am today. Ricardo, my physical activity trainer in the program, motivated me to not quit when it felt hard, and some days were really hard. But it was worth it. He and the other mentors were so supportive of me that I wanted to give back. In 2018, I became a volunteer assistant physical activity trainer for the program at the Watts Family Maryville YMCA. And working with the kids in the program, I tell them, if I could do it, you could do it. This program and my experience inspired me to pursue a degree in exercise and wellness at ASU. Dr. Scheibe and his team are now my mentors. As I work toward my goal of becoming a personal trainer, it is my dream to help people reach their own goals just like this program has helped me. Thank you so much for investing in me and for supporting my journey toward a healthy and a successful life.